We're live. Hello, 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 everybody. It's Dr. Jarrett, America's favorite dentist, doing a special scope for you guys tonight because my special guest is available. You know, her time is very, very precious, so we kind of have to get it together when we can, right? Right. Because you're a very busy woman, right?
Yes.
So I kind of got to go with the flow when it comes to your availability.
Mm-hmm.
Right. Okay. So I'm going to give people a little bit of time to get into the room. We're going to actually go over a couple of things that are really, really important as it relates to kids' oral care. Are you a kid?
Yes, I'm a kid.
Okay. Okay. So we're going to go over a couple of things and show you our nighttime routine. It may be helpful and beneficial for those of you who have smaller kids when it relates to the health of their gums. So let me give everybody a couple of minutes to get into the room. Let me get some music. What do you want to listen to?
I want to listen to You Can Count on Me.
You Can Count on Me? By
I
Whitney Houston and...
I know how to do it.
What you do that? Whitney Houston and...
It's actually not a long song, so...
You Can Count... I don't know what You Can Count on Me you're talking about.
Let's just do Pretty Hearts from Beyonce.
Pretty Hurts from Beyonce.
Mm-hmm.
Did y'all hear this? You tell everybody you are the biggest Beyonce fanatic.
I'm the biggest Beyonce fanatic, and I'm also a fan of her, so...
Well,
I touched her hand twice.
You did. So, fanatic is saying fan is short for using the word fanatic. It's the same thing. Okay? All right. So, do you mind if I tell everybody who I am?
Yes.
You do mind. You don't mind.
I do.
Okay. That's okay. I'm going to tell everybody. So clearly you guys know this live broadcast can go any way because I got my special guest. If it was just me, it would not happen this way. So let me tell you guys who I am. I am Dr. Jarrett, America's favorite dentist, and I am the smile creator at JLM Dentistry in Atlanta, Georgia. It's outside of Atlanta. It's in Smyrna, Georgia. The website is www.jlmdentistry.com. That's JLMDENTISTRY.com. I create healthy and beautiful smiles. Your mouth is my canvas because dentistry is an art form. Well, I must say she does have some good taste in music. And I hope it's not the explicit version of anything. No. Oh, okay, it's the jazz version. We can do that, Eddie. We can do that. So, before we get started with the scope, I need you guys to do me a favor. To the bottom of your screen, to the left, there is a share button. We got some good information tonight, so I really would love for you guys to go ahead right now, share this broadcast with your supporters. I will not take up too much of your time. Please share this broadcast with your Facebook friends and loved ones, especially those that have kids. Also, to the right of the screen, you will see the like button, the love button, and hearts, and some other emotions over there. If I say anything that you like, if she says something that you like, please hit those buttons. You remember seeing those buttons to the right? Yeah. So my look tonight is, of course, football attire. My team did not win, but I'm a diehard.
Falcons won.
You know what? I realized that there will be times that mothers and daughters don't agree, and this is one of those times. But like I said, I'm a diehard Who Dat Saints fan, and I have to give her that because she was born in Atlanta, so we'll let her have that just for a little bit. All right, y'all. So, who are you? Introduce yourself to everybody.
My name is Addisyn, and I'm also helping my mom doing her video for her dentist class.
Okay. So, can you tell everybody what we're going to do tonight?
We're going to tell you what you do after you eat and what you do in the morning.
Okay, so twice a day. So our routine of doing this, Addisyn, is twice a day, right? Right? Okay. So here's the deal, you guys. Exactly, Ladora. She is from Atlanta, so she has to have it. I'm going to let her have this Atlanta shirt. I don't think you guys can see it because look. Okay. I almost burned my fingers. So here's the deal. Because she's out of school, normally her bedtime is like
8 o'clock.
Thank you. But we let you, stay up a little late, right? Because you're out of school. Yes. So we're going to just go over some things pertaining to kids' oral care. It's really not much different than what we do as adults. With kids, you want to make sure that you are watching what they eat. The worst culprit when it comes to kids is, of course, sugary things. More importantly, like the gummy, sticky stuff. I tell all of my patients to make sure that your kids are not eating anything gummy or chewy, like gummy bears, sugar daddies, if they still have those around. Am I telling my age? Sugar daddies and what's the other one like?
It's like you.
Airheads. You don't want to eat the airheads.
Yeah.
Do you eat a lot of candy, Addie?
Not that much. I only like Twix because they're like my favorite chocolate.
Do you eat a lot of it though?
No. I just eat like one. I don't eat them every day.
One every blue moon, right?
Yeah.
Right, because we know that's not good for you. So when you're eating something, after you eat, what do you do?
After you eat, you rinse your mouth with water, then you brush your teeth, then like sometimes you use mouthwash. So you use mouthwash to make all that sugar bugs not like come when you're sleeping.
Right. So what do sugar bugs do?
Sugar bugs hurt your teeth, and they just make them bad, and they're not really. They don't make your teeth healthy. They make they make your teeth like not grow. They just make your teeth like not be clean. Yeah. They make your teeth be, they don't make your teeth be strong.
Yes.
They just make your teeth be all icky and dirty.
Yeah, and we don't want icky, dirty teeth, right? Because we have to have our teeth to eat, live, survive, talk. When you don't have teeth.
And eat, and also for them to...
Take over this.
We need to eat healthy food that will make our teeth strong and make our teeth be healthy for our environment.
Tiff has a question. She says, at what age do you move to fluoride toothpaste? Typically, Tiffany, it's 4. You want to just be able to monitor when your child can comprehend that you don't swallow the toothpaste. So typically,
so it doesn't go down your blood pressure.
Yeah. So they don't want to swallow it. So Uncle Donald's on here too. So yes, we use sugar bugs a lot. I see Dr. Michelle here. Monica is saying sugar bugs. Yes, we use sugar bugs a lot. She knows that eating those things can cause cavities. So here's the deal. What Addie basically was saying is that after she eats something, we make sure we rinse out, right? That's the first thing we do. We rinse out. for 30 seconds. Just water, that's all you need. Swish around, get all that stuff off your teeth that's coating the chewing surfaces of your teeth. Swish around, and then we rinse out. So, and then 30 minutes after that, that's when we brush and floss. Now, I will make it a point to say, yeah, if your kid is at school, you know, most parents don't take toothbrushes to school, let the kids take toothbrushes to school. So the act of actually rinsing out helps out greatly while they're at school. So, you want to show them what we do? You want to show them our routine?
Yes.
All right, so what do we do first?
First, we floss.
Yes. So Addisyn, when we have them, Addisyn likes to use these. You know, I don't like these.
Well, she doesn't like them, and Dr. Howard thinks that they're good for your teeth.
Shout out to Dr. Howard. I think this is good for kids that are learning a routine. But what do we do when you do what you do? Then I come behind you. What do we call that?
Teamwork brushing.
Teamwork brushing and
teamwork flossing.
That's what it's all about, moms and dads. It's all about teamwork brushing and teamwork flossing. I learned at an early age that my child was headstrong. She likes to do things for herself. So we have agreed, and her dentist is in on this. Shout out to Dr. Jaha Howard, who's also in Atlanta. That is my child's dentist. No, I'm not my child's dentist. For various reasons.
She's only for any adults.
Well, I do see kids, just not you.
Yeah, because I'm a little kid.
I think you would do better. You do better with Dr. Howard, right?
Yeah, because Dr. Howard has kid stuff.
Yeah. Yeah, his office is a more kid-friendly office. And
remember when I got 3 coins?
Oh, yeah. See, I don't have coins to give to kids in my office.
Mm-hmm. But you get a surprise, like a toothbrush?
Yes. I always give toothbrush, some other stuff in a bag.
Yeah, because that makes their teeth be healthy and stuff.
Yes, yes. So let me just take one moment again to let you guys know who I am. I'm Dr. Jarrett, America's favorite dentist. And this is
Addisyn.
And we are talking about kid oral care, kid oral hygiene. We're about to show you our daily routine. If you guys get a chance, feel free to also follow me on Instagram and Twitter and Periscope at Dr. Jarrett _DDS. It's DRJARRETT _DDS. And also, I'm normally here every Friday at 12 p.m. Eastern Standard Time. I call it Flossing Fridays, where I give you tips and tools that you can use to improve your oral hygiene. All right, let's get into it, Addie. So you're going to show them how you floss.
Okay.
So you're not going to use that one. No. So she decided not to use the floss picks, which I don't like. So great.
Because they don't have flavor.
Oh. Is it all about the flavor, ma'am?
Yeah, because this has flavor.
Oh, okay.
It has mint.
Okay, okay. Everybody's saying hello to you.
Hello back.
Girl, please. All right. So as you can see, she's getting all the way in the back first. You want to you got to pass through those areas a few times, not just like once. You got to go on both sides of the teeth. There we go. Good job. So, if you notice, Addisyn said she flosses first. We are advocates for flossing first. Hey, Dr. Dawn. Hey, Dr. Walisa. We are advocates for flossing first because most people don't floss, right? So if you floss first, you get into a habit of flossing. And you pretty much will tell yourself, hey, I'm not picking up the toothbrush until I floss. So there's no brushing without picking up that floss first. When you floss, you want to make sure that you are going up and down on each side of the tooth at least 10 times. That sounds like a lot, but it's quick. It's pretty quick. As you can see, Addisyn's already gone to the top arch just from my simple conversation. Look, Grammy's on here. Say, hey, Grammy.
Hi, Granny.
See, that's your picture. She has a picture of you. She says, read what she says.
Good job, my baby's mom.
So Addisyn is doing a really good job. Now she's not doing the 10 times like she should, but what happens after she flosses, I floss. It's not a lot, Dr. Walisa. It's not. It's really not. It's not. It's very, very quick, simple. So your brushing and flossing routine should take less than 5 minutes. Okay, so it's really not a lot. A lot of people will say, I don't have time. Yes, you do. You have time because it is your overall health that you're concerned about. Grammy's in Dallas. Okay. Grammy's in Dallas.
So she went out of town?
Yep, without you.
How? Me.
All right. All right. She said it's disrespectful, Mama. All right, open. So this is what I do. I go in after her and to kind of make sure.
So like a flossing routine of being like a teen, like an adult, like a kid does it first because they want to do it first, and the adults do it last, and sometimes the adults do it first and the kids do it.
Oh, everybody's watching together. My mom, Grammy's watching. Cousin Jamie, everybody's watching, and I'm sure my Aunt Johnny's watching too.
Okay.
All right.
Is God watching?
God is always watching, baby.
Okay.
Yeah. Ladaris asked, what age did Addie start flossing? As soon as she had teeth.
As soon as I had teeth.
Even with one, you got to get to it.
If I just had two, I would just get those two and then I'll be finished. That'll be just so easy.
Okay, so I'm just gonna I'm gonna show you guys what I do. Yes, my hands are larger because my hands are supposed to fit my mouth.
And my hands are supposed to fit my mouth.
Yes. But before you floss your child's teeth, make sure your hands are clean.
And they're also not dirty, so you have to look at your hands.
Yes, so you make sure you wash your hands before you put your hands in your child's mouth. And it's not a lot of your hands.
Well, mostly at her dentist, she used gloves.
Yes. In my office, we use gloves. Okay? All right. So, basically, I'm doing the same thing Addie did. Getting back there. Now, she has started to get permanent teeth. So usually you will see kids start to get permanent teeth around late 6 years old. They're called 6-year molars. The first molars. She doesn't like when I do this either. Oh, you do? That's what you fronting for everybody. You're fronting for everybody. So here's the deal. When you floss, you want to make sure that, let me sit back down. You want to make sure your tooth has some curvature, right? To the side. So you want to make sure you're going in that same curvature. It's like a C shape. It's what we like to call it in the dental field. So there's a C shape up and down on each side of the tooth at least 10 times. So think about it. When you're brushing, you are in that area for a little while, right? So you want to make sure you're cleaning just like the sides of your teeth, just like you do with a toothbrush. What were you gonna say, sweetheart?
I was about to say that you have to floss and brush on the right path, and you have to floss and brush on the teeth, not the gums.
You sure you don't want to be a dentist anymore?
I do.
Oh, you changed your mind. You want to be a dentist now. So I shouldn't sell the practice. I should just give it to you.
Exactly.
Okay. All right. Okay, so let's just say, for the sake of time, we finished our routine of flossing. What's next, Addie? Are you going to say something?
Someone said,
what age? It says, what age did Addie start flossing? Miss Ladoris, and I already answered that.
I just did know about that number.
It's
good information.
Yes, yes. All right, so the next step, what's the next step?
Next step is toothbrush.
Okay, so do you recommend the Reach flosser? No, Kim. No. Good old fashioned. Good old fashioned. This is the best floss ever.
Not this.
Glide floss.
Not this one. Not this one.
Not that one. This is the best floss. Glide floss.
Because it makes your...
They didn't pay me to say this either. I really use this.
This one makes your teeth be strong. And it makes your teeth be healthy and also between your teeth.
Yes. All right. So, hey, Vince. So what's next?
Next toothbrush.
Next toothbrush. So hold on. Let's talk about the toothbrush. Addisyn is old enough. I mean, we've pretty much been using an electric brush for a while now.
And this is why you use the electric brush, because you don't use like one of these brushes.
It's okay if you do, but
it's okay if you do.
But what happens? What does this do better?
It has a timer and it can tell you when you stop. Not this one.
Right, and it cleans a little bit better because the bristles are moving quicker than what you can do with this.
This is like moving slower.
Yes.
It's just moving like slower. It's not like really fast.
Right.
But you can still use this. It's not like it's bad for you.
Oh, that's what I'm talking about. Get this girl a degree already. All right, so you're going to show them how you brush? All right, let's get to it. Let's see, Katharina. That is Oral-B. Yeah, it's Oral-B. I sell that in the office. That brand of toothbrush. And the same thing with kids' toothbrushes. You want to make sure you're changing out the brush heads every 3 months. What we typically do, she just got back from my in-laws' house for the holidays. So what we typically do when I send her away, I make sure this stays. Yes, Danica, she might be there your next visit, checking and giving you an exam. I make sure this brush stays because I just don't want any. It's an investment, and the electric toothbrush is an investment. I make sure it stays, and we typically have her use this while she's away, like sleepovers, when she's at family, with family. So kids can use the adult version. No. Okay, so there are, like, Oral-B has stages. So if you notice, if you go in in Target or Walmart or any store, and you go down the toothbrush, the oral care aisle, you will notice that like Oral-B has stages. So the brush heads tend to get larger as the kids get older. So I typically try to stick with Oral-B. Yeah, that's what I was answering. I typically try to stick with Oral-B because the brush heads tend to increase in size as they get older. If you look at this one, you can kind of tell it's a little bit smaller than an adult brush. Oh, really, Dr. Lisa? Tell your mom I said hello. And she's going to do better. All right, Addie. So I don't know if you heard the difference in the brush, but it made a different tone when it was at 2 minutes. I don't think you hit that other side. But go ahead and spit that out. All right. So she brushes, and then I just kind of go over what she's done. Ready? Mm-hmm. Turn around. And I just go over what she did. She is typically a good brusher, so I really don't have a lot to do. You just got to know your child if they are not doing what they're supposed to do. I never advocate your child doing this without you. Like leaving the room, because we know how they play around in the bathroom. You play around in the bathroom sometimes, right? Mm-hmm. See? I appreciate your honesty. Yeah. All right, say cheese. Oh, and one big key, a lot of times, smile here. All right, you forgot to do what? No, brush your tongue. Don't forget, your kids need to brush their tongues. A lot of times, a tongue scraper is a good tool as well. A lot of times, this area in the cheek, the tooth surface all the way in the back is a common area for kids and adults to get tartar. And a lot of people think getting back there requires you to open really, really big. But the way to get all the way in the back is to open slightly. I'm going to turn the water off for me. So it's to open ever so slightly. That allows more flexibility in your jaws. If you're open really, really wide like this, your jaw's not as flexible. But if you open slightly, then it gives you the toothbrush more space to get back there in the back to do its job. My mom asked why I'm against the floss picks, because they don't clean as well as good old-fashioned floss does. So I really think good old-fashioned floss is the best. You have two hands to maneuver and get in between your teeth, and I think it just does a much better job. Yes?
I'd like to say something.
Go ahead, ma'am.
Sometimes you don't get your teeth very well, but sometimes you do. Mm-hmm. If you don't get all the way in the back, sometimes your teeth get rotten and mold and brown. So.
Rotten, molded, and brown. We're going to take out molded. But yes, rotten and brown. And we don't want that, right? Because you need your back teeth to chew, right? Right?
Right.
Okay, see? They're giving you likes because they like what you just said. All right, so one last thing. One last thing. Addisyn, what is the next step?
The next step is mouthwash.
Yes, ma'am.
So you put your mouthwash in your mouth and then you squish it for 60 seconds. Mm-hmm. And then you spit it out, and then your teeth get more shinier and they get more clean. And they also help the cavities.
Yes, come on now.
Be so shiny and
not cavities shiny. It just prevents the cavities, right? Right.
It just takes away the cavities.
Yeah.
And also they don't there's no more cavities on there. You can just see your teeth are white and not gray and brown something. So the mouthwash helps you to get your teeth very clean and defloss and debrush. So
well said.
So if you're a dentist, try to just get everything in your mouth, because sometimes you don't get everything in your mouth, but you get everything in your mouth because it has to be clean and it has to be not dirty. It has to be shiny, and so everyone can see that your teeth are shiny and clean, and not dirty. Because they don't want to say ew if they're dirty. Right,
and that could lead to bad breath and all that kind of stuff too, right? All right, so this is what we typically use. It is Act Kids. Bless you. It is the bubblegum flavor. We go with bubblegum flavor because
pink is my favorite color.
No, it's not. No, it's not.
It is.
No. Why do you have that red shirt on?
Okay, that's a point.
That's a good point. That's a good point. Yeah, I know, Monica. Miss Monica says you could have done this video without me.
Oh no.
You were afraid at first, right? But I told you it was gonna be a piece of cake.
No.
I've actually been trying to get you to do this video for about a month.
No.
So this is what we use. We use Act Kids. We are running low. It has the ADA seal of approval on it. So let me tell you one thing. When you brush, you really should not rinse with water afterwards. Because, see, Miss Laura said no pink. She said no pink. Not too many people on this feed like pink.
I like pink.
Well, I don't know why.
Because pink.
Train up a child.
Okay, fine. If you don't want me to like pink.
It's up to you, sweetie. It's up to you.
Well, you like red.
Thank you.
You don't like black. So why?
I got this black shirt. Yeah, black lipstick for the Saints. So we use Act, and
Daddy,
so let's do this. You can find this everywhere.
You can find it in the store.
Yes, they have different flavors, but we typically like to stick with bubblegum. So you want to show them how you use it.
Okay. So you squeeze it, then and it comes out. Mm-hmm. Then
whoa.
Okay.
Okay. Well, go ahead. It's your stuff. Okay. So she's supposed to be swishing for 60 seconds. So while she's doing that, she counts. Sometimes she doesn't. But while she's doing that, let me just So while she's doing that, let me just continue what I was saying about the toothpaste. The toothpaste has fluoride. Fluoride is pretty much the active ingredient in the toothpaste that helps to protect your teeth. Normally with fluoride, you can't eat, drink, or rinse out for 30 seconds. We follow up with the mouthwash because that is like our last absolute thing to do. Oh, look. You see, it says Sarah Cook Harden. You know, who's your principal? You know your principal's name. Well, Miss Sarah was my first principal in my elementary school. Yes. Hey, Miss Sarah. So, what I was saying about the toothpaste, if you are, I'm a biggie with brushing and flossing, right? You can use a mouthwash if you want to. I think kids should use a mouthwash, but I think you're good. You can spit it out. Yeah, you can spit it out. I think kids should use a mouthwash for that simple fact of if you're going to be rinsing after you floss. So we follow up with the mouthwash. She's only rinsing the sink out right now. She's not. And washing her hands, she's not rinsing her mouth out. So that's typically it. So you've seen our nighttime routine, which is much quicker. I mean, we're kind of demonstrating some things with you.
I want to do this by myself, I think.
You want to do it by yourself?
Okay.
Oh, okay.
Okay, so sometimes you use the wrong mouthwash, but sometimes you do, and also sometimes the adults use the blue mouthwash.
Yes.
And some girls use the pink ones. Sometimes they do, but not everybody. Some people use blue ones instead of pink. But the pink one's for kids. And so, and also there's different toothbrushes and flosses.
Yes, Kim.
Because they're all different colors and different and also different sizes.
Yes, Sam.
And also my mother gives out a lot of great teeth because she cleans them very well and very, very good because she is the one who's the greatest dentist.
Yeah! I didn't know you to say that. I did. You think I'm a great dentist?
Yes.
Yes.
Because you have the most good accessories.
I have the best accessories?
Yes.
In the office?
Yes. Like you have what are those shot thingies? What are those called?
It's a syringe.
A syringe that makes your teeth go to sleep.
Yes, they make your teeth go to sleep.
And so they make your teeth go to sleep so it doesn't mean any harm. She's not like trying to like not hurt your teeth. She's trying to make them feel comfortable. And
Miss Danica says, you remember Miss Danica from church? She says she seconds that. She says, I'm a great dentist too.
And so she also helps them get cleaner and sparkler, and also Dr. Howard, because they're a pretty great team. So they also work together as a group team, because she's the boss of her team. And Dr. Howard's the boss of his team.
Okay.
So we're like normal routines of being like everybody likes brushing, right? Everybody likes.
Okay. Type of 1 if you like brushing. Let's see how many ones come up.
I like brushing.
You like brushing?
She likes brushing. My dad likes brushing, and everybody likes brushing.
Do the dogs like brushing?
We never brush their teeth.
Why not? Because they're your dogs.
Well, we're going to teach them how to swim.
What? Okay. See, all the ones. See, everybody else says 1. Okay. Type A 1. No. Type A 2 if you like flossing. It should be just as...
Type A 3.
No, it should be just as many 1s as I see 2s. I mean, it should be just as many 2s as I see 1s, people.
And also do a 3 for mouthwash.
Oh, a 3 for mouthwash. Addie wants you to do a 3 for mouthwash. So
yes.
We should see a lot of 1s. We should see a lot of 2s.
This is very important. This is very important. Never drink Coke.
Oh, I am gonna leave, y'all. I gotta go because she got this. She has this broadcast handled.
Never drink Coke.
Repeat that again.
Never drink Coke. It makes your teeth be bad, very bad. It makes your teeth be brown, and it doesn't make your teeth be white. It makes your teeth be brown. You should never use that Coke. It is very bad for your teeth. Like, seriously, very bad. This is not a smile.
It's not. I'm sorry, y'all. Okay, so, yes, Lori said, oh no, Coke.
You drank Coke?
Monica says, I just drank a Coke. I'm addicted. What should she do?
She should just not drink Coke ever again for the rest of her life.
Okay, that sounds like a plan.
Yes.
What about
juices? Oh, well, some juices are good, but, well, okay, no. Some juices, like orange juice, sometimes you drink that at breakfast and milk. But milk is white, so it makes your teeth white too.
Oh, wait, tell me this. What do you do? What's your routine in the morning? Do you eat before you brush your teeth? Or do you brush your teeth then eat?
I eat first, then I brush my teeth.
Mm-hmm. So you get out of bed and
you don't brush first. You don't brush first because you have to eat second, and sometimes
Tell Grammy, Mama.
Love you, Granny. And also sometimes you brush your teeth, and sometimes you forget to drink Coke.
This look is for you, Treva.
Okay.
Look, Miss Treva. What did Miss Treva say?
What about hard candy? Hard candy. You should never have hard candy because it breaks your teeth.
I don't have to say anything. She knows it. She knows it all.
And ice breaks your teeth.
Yes.
Because if you eat all of that every day, you have no teeth for the rest of the day.
That can happen.
And also, just like these 2 teeth, they're grown. They are
adult teeth.
Yes. And I'm about to be adult, actually.
Look what Grammy wrote.
Grammy, never drink Coke, okay? Never drink Coke. You can say that you love Coke if you're loving sweet. But never drink Coke. Never. Never drink Coke.
Coke, she's saying Coke, but it really pertains to... Anya says she's going to drink Pepsi. It's the same thing. I can't fool with you, Anya. No sodas, people. No sodas.
No Pepsi, no soda, no Coke. Those 3 are bad for you.
Okay, so we're going to let everybody go. Is there anything else you want to tell the people that are watching right now? See that number that tells you how many people are watching? That's a lot. Is there anything you want to tell them about
I want to tell them some more lot. Happy New Year's, and also get a call. And how to spell my name is Addisyn. And also, I'm at the Galloway School. And
don't tell anybody where you go to school.
Yay! Okay. And also, thank you for saying that. Thank you. And also, please don't drink that Coke, and also the hard candy, and also the ice, because it's not what you drink. You drink water, because water makes your teeth be healthy.
No, Mom, not even Diet Coke. Those sodas are too acidic. All right, so I really hope you guys gained some knowledge. Yes, Troy, she will. That's why I'm about to get off the broadcast. I hope you guys gained some knowledge. Once again, I would love you to share this video with your family and friends, especially those that have kids.
And also your cousins and sisters and brothers. What? I know.
Yeah. So, once again, I am...
Thank you for drinking a lot of water.
Yeah.
Lots of water.
Yes, water hydrates you and
makes you not be sweaty.
Well, okay. She asked about ice. Dr. Addie, do you want to tell them about ice again?
My kids are loving this. What about ice? Okay, so about ice. Never have ice and never just eat it
crunch and chew. Yeah.
Yes, crunchy, and it makes your teeth just be frozen, and it breaks your teeth.
Let it go. Yes.
Don't say that.
Yes, it is harmful. Too much ice is harmful, and most people that eat ice are anemic. That means they have low iron in their body. So if they take iron supplements, that can combat the anemia, and that can eliminate them eating so much ice.
You also do everything that's good. You drink good water, and you drink fresh water, not dirty water. And not seawater, because that makes your teeth be so dirty, because it has dirt in it and sand. So you don't want that to get in your teeth, because you're going to have to brush a long time. She said, frozen.
Yes, Dr. Janae said frozen. All right, you guys. I think you did a good job, Addisyn.
What about coffee?
Okay, what about coffee, Addisyn?
Sometimes you drink that for breakfast with Starbucks. And sometimes you drink...
What do we get from Starbucks? We
get hot chocolate, and we get banana bread and pumpkin bread. Because that's my favorite.
But what about the vanilla steamer? We get that as well.
I don't drink it anymore.
Okay, you
drink it.
I drink that, yes. So no, I don't drink coffee.
How about my dad drink coffee?
Daddy doesn't drink coffee either.
Okay, I knew that.
Yeah.
We
are no coffee house.
We have no coffee house in here. We drink tea though. Like sweet tea.
I don't drink sweet tea. You drink sweet tea when you're with Grammy.
Yeah, because that's my favorite sweet tea.
But it has sugar in it, right?
Yeah, but I don't like it anymore.
Oh, okay. There we go.
That's the problem.
That's handled. All right, you guys. So we're gonna go.
Well, no, we're not, because I have a bunch of answers to say. So sometimes you don't brush your teeth every day, because sometimes you forget to brush your teeth. Sometimes you don't. But hey, Addie, this is your
cousin Yuri. What about Capri Suns? You know those little juices in the little pack. What about Capri Suns? Can you have Capri Suns? No.
Because they have sugar.
Yes.
And they make you have cavities.
Mm-hmm.
And also,
I'm not sure. While you think about it, let me just finish out, okay?
And also,
it's after 10.
And also, please, sometimes you eat cupcakes. Cupcakes have sugar too.
Right. So
and also cake. Just like my grandma made too.
Yes.
And also, it's pound cake. My daddy's favorite cake.
Just throw him under the bus.
And also, sometimes we eat cake and cupcakes. And also, I eat salad too.
Yeah, salad is good. You know, I really appreciate you guys watching. This video ended up being a little longer than I expected. And I appreciate you guys taking the time out of your schedule and your nighttime ritual to be with us.
Okay, I'll try.
Yes, and I'm Dr. Jarrett. I'm Dr. Jarrett. Your America's favorite dentist. I am also the smile creator at JLM Dentistry in Smyrna, Georgia.
I would say sorry for hurting everybody's feelings. Now you.
That is outside of Atlanta, Georgia. Yes. I create healthy, beautiful smiles. Dentistry is an art form, and your mouth is my canvas. You can follow me here on Facebook Live. My public page is Dr. Jarrett DDS. That's DrJarrett DDS. Also, you can follow me on Periscope and Instagram and Twitter at Dr. Jarrett _DDS.
I like to say something else too.
Okay, hold on. DrJarrett _DDS. I have a free book for you guys that I forgot to mention. Go to my website at www.jlmdentistry.com/free book. FREEBOOK. That's JLMDENTISTRY.
She asked.
I get it. /FREEBOOK. I'm going to be here every Friday. This is just a special scope because Addisyn was out of school and we let her stay up a little bit late. We talked about kids oral care. Please feel free to share this. I would love for you guys to share this with your friends and family. To the left of the screen, there's a share button. So go ahead and do that now. To the right, likes, hearts, all that good stuff. If you really enjoyed the broadcast, if you have other topics that you would like for me to discuss, message me. You can comment in the broadcast as well. Mouthwashes, I'm just looking at one question before we go. Mouthwashes without alcohol are the best. Alcohol is a drying agent. So keep in mind that it's going to decrease the production of saliva in your mouth. So you want to make sure saliva is beneficial. It helps to protect and coat your teeth and protect your teeth from harmful things. So you want to have enough saliva in there. So alcohol is definitely a drying agent. They do have Listerine without alcohol. That's the Listerine you should get. But Colgate, Crest, all the major brands have a pretty good mouthwash without alcohol. I'm gonna let Addisyn. What about chewing tobacco? No, negative. No. We're not gonna do that, right? No. Nicotine, harmful. death. So no, chewing tobacco is a no-no. All right, you guys. But that's a good topic, so I may have to do that.
I want to say something.
Addisyn is gonna have the last word. I'm gonna see you guys later. Still, who that? Okay.
I have
go ahead.
Like 3 words.
Go ahead.
If you live at Georgia, please go to Dr. Howard's dentist, and also Mom's, and also actually Jarrett's, and
Jarrett's,
and also hers is good, and also Dr. Howard's, because Dr. Howard's have shiny teeth and hers has shiny teeth. And also, she has shiny teeth for men, women, girls, boys, and also Dr. Howard has shiny teeth for girls, boys, and also Dr. Howard's the best, and also her.
Dr. Howard's gonna have to pay me after this. You think so?
Yeah.
Okay. So you actually love.
And also I love Dr. Howard because and also you.
Oh, thank you so much. I'll just go over here and I'll walk away. Just go ahead. Go ahead. Yes.
Thank you. And also Dr. Howard is the best, and also we also brush our teeth for a long time until it's 2 minutes, and Dr. Howard is my dentist, and Dr. Howard.
Okay, keep going.
And also Dr. Howard is the one who makes our teeth shiny, and my mom, because Dr. Howard makes.
So Dr. Howard deals with kids, and mommy deals with
kids and adults.
Yes.
Well, some kids, like one kid, because she was screaming. And also, Dr. Howard.
Okay, Fran, all you really need in the bathroom as far as oral hygiene is concerned is brush and toothbrush, floss. We typically use Tom's toothbrush because it has like a really pleasant strawberry taste to it. They have a version.
Boys.
Yeah, she's Sandra says go Cowboys. That's her football team.
Is that my football team?
Well, what shirt do you have on, ma'am?
I have Atlanta.
Yes, show everybody your shirt.
Okay. See? Atlanta football. I mean Falcons. Falcons.
Okay, so I'm sorry, Fran. So basically, all you need in the bathroom is floss, and toothpaste, and the mouthwash for kids. I was talking about the toothpaste. The toothpaste that we use is Tom's. It's an all-natural toothpaste with fluoride. They have a version with fluoride and have a version without fluoride. Grammy says good night.
Good night, I love you. And also, we also use minty toothpaste because it makes like all those sugar bugs eyes be burning.
Yeah, it makes the eyes burn. Right.
And they go out of my teeth because they like the toothbrush, the electric toothbrush makes your teeth.
I'm sorry.
The electric toothbrush makes your teeth be a lot, your teeth be shiny, and also they like make your teeth be a lot cleaner, and the sugar bugs don't make your teeth be like, yeah.
Okay.
It makes your teeth be icky.
I don't know if I can do it, Sarah. I don't know if I can take it on the road.
Because I said your words out of your mouth.
You do say the words right out of my mouth.
Yes.
Yes.
I just said the word out of your mouth.
Kids and adults should change their toothbrush every 3 months, Fran. All right, Addie, you ready? You ready to go to bed?
I'm not even tired.
Okay.
I want to stay up for a little bit.
Okay, I'll let you stay up tonight.
For 20 hours.
20 hours? Yep, you got it. You can do that.
Yes.
All right, tell everybody.
I know sometimes you got to love them anyway. Falcons. Falcons.
That's Falcons. Anyways, all right, you guys.
This is how you spell Falcons, just in case. Falcons.
We've been on here a long time, Nika, just because she wants to extend the broadcast. All right.
Nika. Did you say Nika?
No, I didn't say Aunt Nika. All right, you guys. Thank you guys so much for watching. Tell everybody. Tell everybody thank you.
Thank you for watching my video.
Okay, y'all, I gotta go.
Our video.
Thank you, Loba. Thank you. Once again, don't forget to share, tell your friends, and of course, we may do special scopes in the future. Love you guys.
And also, if you want us to do another video, download.
What we download?
Okay, nothing. Never mind.
Never mind.
You say it. It's yours.
Okay. Happy New Year's. We wish you peace and blessings and God's greatest joy in 2017.
And again, if you want us to make another video, please just type in make another video.
Don't have to type that in. So you mean a video with you, because Mommy does videos all the time.
Mommy, and also I would like you to meet my dog, Coco.
Okay, y'all. After you guys see the dog, go ahead. After you guys see the dog, I gotta go. I need.
See Coco. See Coco.
Okay. And she treats the dog like it's her baby, as you can see. All right, you guys, don't forget to share the video. Love you guys. Thanks for all the support.
And it's also a schnauzer dog.
It's a miniature schnauzer, yes. Coco Mademoiselle. Okay, guys. Love you guys. Bye.
Love you guys. I love you. Happy New Year's.
It's New Year.
Happy New Year.
Yes. All right.
Bye.
Bye.